Hi, I'm Christina Marie, and you're watching the big day of TV, where we are coming together to make 200 minutes of impact with 20 nonprofits in one day. Let's just get to it, shall we? I'm here with Dr. Jonathan Porteous of WellSpace Health. How are you?
I'm well, thank you. Thanks for having me.
Yeah.
And thanks for doing this.
Oh, you're very welcome. Tell us about your mission. What is your mission?
Our mission, concretely, is achieving regional health through high-quality comprehensive care. And the goal of our organization is to bring up the well-being of the people with the least.
Oh, that's fantastic. So what are some of the things you do to execute that mission?
Well, WellSpace Health is a broad health and behavioral health nonprofit. It's essentially a behavioral health and health system for low-income communities in the Sacramento region. We provide an enormous amount of primary care, behavioral health services, women's health services, dental for kids.
Wow.
We're talking about 400 and something thousand visits a year.
Wow, that is a lot of people served in the Sacramento region.
Yes, there's about 125,000 patients currently.
That's incredible. What would you consider your signature program?
I would say the signature thing about the organization is devotion to the community. We're always about looking for needs that we can meet. Mm-hmm. A lot of people know us for healthcare. A lot of us people come into different sites for different things. And the thing that I think we would like to focus on right now is the 988 system, the mental health crisis,
yes.
Suicide prevention mental health crisis system.
I just heard about this. So let's go into a little bit of detail about that.
Yeah.
If someone is in crisis, they shouldn't call 911 per se. There's another number to call?
Yes, it's 988. It's the old suicide prevention national lifeline that's been taken from a long number, an 800 number, to 988. And it's now not just suicide prevention, it's suicide prevention and mental health crisis. That's a 24/7 lifeline. WellSpace Health operates it across many counties in the state. We're across most of the state.
And you have counselors, therapists there to pick up the phone?
We have highly trained suicide prevention specialists. Once we've assessed lethality, we can take care of many other issues, including mental health crisis, a lot of dispatch, a lot of deployment of services, directing to people to resources. We have a whole, what we call a crisis response continuum.
Okay.
And that is based here in Sacramento. And we're getting about 120,000 calls a year through that.
Wow.
But with the advent of 988, it went from 1-800-273-8255, which you will not remember,
No.
to 988, which you will.
Yes.
So we're anticipating about a tripling of volume. And when you have a high-risk program like that, growing that quickly, no one can predict how much it's going to cost to run, and
Right.
that's why we're focusing on it here. We're saying, wow, this program is expanding.
Yeah.
The more we talk about it, the more people call it. And it's a very difficult thing to pin down in terms of financing and support.
Right. So, and that actually leads us to the next questions. How have you traditionally found sources? Like, how have you been traditionally funded?
We have been funded through various grants. We write grants. But now, increasingly, the federal government is putting some money into suicide prevention, which is coming down to the states. Our local counties have been supportive. But what we're looking at here is a complete re-engineering of the entrance to behavioral health services. People in crisis overall, substance use, mental health, suicidal crisis, have actually a place to call that will answer the phone 24/7. And so it's becoming kind of the front door, or maybe the front porch, to all of these kinds of services in every community. Also dispatch for mobile crisis.
Wow, yeah.
So it's an enormous sort of panoply of services across the state and across the country.
So do you have any special needs or immediate needs for this program?
I think our immediate need is to actually fund it.
Okay.
We already know
Right.
that the work needed exceeds the funding available.
Right.
And so really what we're focusing on is asking for support in doing that.
And so this is why you're participating in the Big Day of Giving, which is happening May 4th this year. So what is your Big Day of Giving funding goal?
Our Big Day of Giving funding goal for 988 has been $100,000.
Okay. So that is a big lift this year.
It certainly is. This is the 3-digit number for anyone in crisis anywhere in our region, 24/7. It is a total lifeline.
Yeah, it's extremely valuable. I actually know some people who've already used it, and they told me about it, and I told my teenage daughter about it because, I mean, especially with COVID and all the pressures recently, people need to know this shorter number to use. The Big Day of Giving isn't just about a cash goal. There are other goals in the community, like maybe finding some new donors, finding some volunteers, some board goals. What are some of those goals for your organization?
We're always looking for volunteers. We're always looking for people who are interested in this kind of work as well. Much of it is paid. This is a highly trained, skilled suicide prevention specialist. We do the training. And so this is a great opportunity for people to engage. What I love about the Big Day of Giving also is that we come together and show the fabric of our community.
Yeah.
And you know, I often sort of think of us as sort of planks lying on the ground, and when you lean them against each other, there's this strength that comes from it, and structure. And we have a stunning community. I mean, the Sac Republic, I don't know if you saw it, they've actually now got 988 on their football kits, soccer kits, sorry, wrong country. So they are now wearing 988 on their sleeve. And
That's great.
They'll have 17 away games where they're bringing it to communities where they recognize 988 as well.
Yeah.
And you're right, we've had a massive mental health crisis. COVID, the Great Resignation, all of these forces imply that there's a lot more isolation, depression, anxiety. We know that.
Yeah.
And this hotline, this lifeline is there for that.
Yeah, it's extremely important work that you're doing. I would ask, what is your favorite part of your organization? What appeals to you the most?
My favorite part of the organization is my 1,100 colleagues.
1,100 colleagues that take their time to execute mission.
That we're all bonded in this sort of mission of service.
Yeah.
It's really, really very meaningful. And I think each of us derives a personal meaning out of it. But together I like to say we're kind of a force for good.
You are.
And I know that many of my colleagues you'll be interviewing are the same.
Yeah, I know that's the best thing about the Big Day of TV, because we get to interview so many organizations and hear about so many great missions helping the Sacramento Sierra region. I really appreciate you coming on to television today to tell the community about what you do, and I really hope that Access Sacramento is an integral part in getting the word out about 988.
Thank you.
Thank you so much for being on the show.
Thank you so much.
This organization is participating in Big Day of Giving, which is May 4th. For more information, go to bigdayofgiving.org and look up WellSpace Health.